When a pregnant woman says, "My water has broken" or "My water is leaking," what exactly is this water she is talking about? Is it urine? Is it discharge? Where does the water come from? And what happens when there's too much or too little of that water? Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. Today, let's talk about the fluid surrounding your baby in the womb. It is called the amniotic fluid. What exactly is this amniotic fluid? Amniotic fluid is the fluid that surrounds your baby inside the amniotic sac. It is popularly called water in layman terms. The amniotic sac is the protective sac in which your baby develops during pregnancy. All these are contained inside the womb. Think of your baby as being inside a protective, fluid-filled environment. And this fluid is actually very important. It helps to absorb shock from external pressure or minor physical impact. It allows your baby to move freely. It supports normal development of the baby's muscles and bones. It also contributes to normal lung development, and it helps to maintain a suitable environment around your baby. So it is not just water that is sitting there doing nothing. It has important functions throughout the pregnancy. So where does this fluid or this water come from? The source of the amniotic fluid changes throughout the pregnancy. In the later part of the pregnancy, the baby's urine becomes one of the major contributors to this amniotic fluid. Your baby swallows the fluid, it passes through the baby's digestive system, and the fluid is continuously exchanged and regulated. So while people call it just water, the amniotic fluid is a dynamic fluid that is continuously being produced, swallowed, and replaced by the baby. So what does it mean when a pregnant woman says, "My water has broken"? Your baby is not swimming in an open space. The amniotic fluid is contained within the amniotic sac, which has membranes surrounding it. So when those membranes rupture, the amniotic fluid can leak out. This is what people commonly mean when they say, "My water has broken." The medical term is rupture of membranes. One important thing you should note is that not every fluid coming out from the vagina during pregnancy is the amniotic fluid. It could be vaginal discharge, it could be urine, and sometimes it can be difficult for a woman to tell the difference herself. So if you are pregnant and you notice a sudden gush of fluid or persistent leakage and you are not sure what it is, don't simply assume that it is discharge or it is normal. Get assessed by your healthcare provider. Now let's talk about the amount of the amniotic fluid. During an ultrasound, we don't simply look at the baby. We also assess the environment surrounding the baby, including the amount of the amniotic fluid. And there are different ways of assessing it. Two most commonly used methods are the single deepest pocket method, also called the deepest vertical pocket, and the amniotic fluid index, or AFI. With the deepest vertical pocket method, we identify the deepest pocket of the amniotic fluid that is free of the baby's body parts and the umbilical cord, and we measure its vertical depth. Generally, less than 2 cm means oligohydramnios, meaning the fluid is too little. 2 cm to 8 cm is generally considered normal. 8 cm or more means polyhydramnios, meaning the fluid is too much. Then we have the 4-quadrant method. The abdomen is divided into 4 quadrants. The deepest vertical pocket of fluid in each quadrant is measured, and the 4 measurements are added together. This gives us the amniotic fluid index. Generally, 5 cm or less means oligohydramnios. More than 5 cm to 25 cm is generally considered normal, and 25 cm above is called polyhydramnios. That means the fluid is excess. That is why in your report you notice these values attached to the amniotic fluid explanation. If you're seeing something between 2 cm to 8 cm or between 5 cm to 25 cm, depending on the method they use, it is within normal ranges. But anything outside these values is considered either too high or too low. Usually we find more amniotic fluid in multiple pregnancy, that is twin gestation or triplet gestation. Usually the amniotic fluid is always slightly higher, and sometimes we consider it a normal finding as long as it's not severely high. So what is polyhydramnios? Polyhydramnios means there is excess amount of amniotic fluid. There are several possible causes. For example, it can be associated with maternal diabetes. Certain fetal conditions can affect the baby's ability to swallow or absorb fluid, or conditions that can cause increased fetal urine production. But sometimes, despite investigations, no specific cause is found, and the severity matters. Sometimes, if it is mildly increased, we can only monitor it over time, but when it is severely increased, then you may require medical intervention. So please note, mild polyhydramnios is different from severe polyhydramnios. So hearing the word polyhydramnios alone doesn't automatically mean that something is seriously wrong with the baby. Now, what about oligohydramnios? This is the opposite of polyhydramnios. Oligohydramnios means there is little or less amniotic fluid than expected. There are several possible causes. One important cause is leaking or ruptured membrane. It can also be associated with problems affecting placental function and certain fetal kidney or urinary tract abnormalities, because the fetal urine contributes significantly to the amniotic fluid later in the pregnancy. Oligohydramnios requires immediate medical attention, as the baby could be in distress if left unattended to. One last thing, if your water breaks, the fluid may come as a large gush, but it doesn't always happen that way. Sometimes there can be small amount of fluid leaking continuously or intermittently. And because urine and vaginal discharge can sometimes look or feel similar, it may be difficult to tell the difference yourself. So if you are pregnant and you suspect your water is leaking, don't ignore it. Get assessed. So the next time you hear a pregnant woman say, "My water has broken," you know exactly what she's talking about. She's referring to the rupture of the membranes surrounding the amniotic fluid. The baby is contained inside this membrane, and during an ultrasound, we assess how much fluid is surrounding the baby. Too much is called polyhydramnios, too little is called oligohydramnios. And we can assess the fluid using two methods, the single deepest pocket or the AFI method. That is why you might either see 2 to 8 in your results or 5 to 25. Both of the methods are accurate. Personally, I use the deep pocket method, so my values usually range between 2 to 8 centimeter. So remember, for the deepest pocket method, less than 2 centimeter is low, 2 centimeter to 8 centimeter is normal, 8 centimeter or more is high. For AFI method, 5 centimeter or less is low, more than 5 centimeter to 25 centimeter is normal, 25 centimeter or more is high. And for multiple pregnancies, sometimes you notice slightly higher values of amniotic fluid. So if you're pregnant and you're experiencing a gush or continuous leakage of fluid, don't try to diagnose it yourself. Get assessed by your healthcare provider. Don't forget to like, share, and subscribe, and share this video to someone who might need it. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section, and I'll see you in my next video.